Hey there, friends. I'm Pharmacist Michael. I've spent years working with dementia patients, and after 36 years in pharmacy, I've been getting this question more and more. Do statins cause dementia? Today, I'm giving you my honest professional take. No hype, just facts. So let's get into it. Some people say statins cause dementia. Others say they prevent it. So what's the truth? Well, I've done some research, and today we're diving deep into statins and brain health. Do they protect your memory, or could they be putting it at risk? Let's break it down. Before we can talk brain, let's talk basics. What exactly are statins doing in your body? Well, statins are some of the most widely prescribed medications in the world, used to lower LDL, or bad cholesterol. They include drugs like atorvastatin, simvastatin, and rosuvastatin. These meds work by blocking an enzyme in your liver called HMG-CoA reductase, which plays a big role in cholesterol production. And for millions of people, they're lifesavers, literally. Statins reduce the risk of heart attack, stroke, and even death from cardiovascular disease. But here's where it gets interesting. Your brain needs cholesterol. In fact, it holds about 25% of all the cholesterol in your body. So what happens when we start lowering it, especially in older adults? Okay, here's where the debate heats up. Can statins cause memory problems? There have been case reports of people experiencing memory loss or confusion after starting statins, so much so that in 2012 the FDA added a warning about possible cognitive side effects. But the research is far from one-sided. Several large studies, including data from over 23,000 patients, found no significant increase in dementia risk with statin use. In fact, some studies suggest statins might reduce the risk of Alzheimer's disease and vascular dementia, especially in people with risk factors like high blood pressure or diabetes. So why the confusion? Well, part of it comes down to which statin is used, how much, and who's taking it. Not all statins are created equal, and this detail might matter more than you think. Statins fall into two main categories: lipophilic statins, like simvastatin and atorvastatin, which can cross the blood-brain barrier more easily, and hydrophilic statins, like pravastatin and rosuvastatin, which are less likely to enter the brain. Some researchers believe that lipophilic statins might interfere with brain function in sensitive individuals, but others think they may actually help reduce brain inflammation and protect against dementia. The evidence? Still mixed. That's why many neurologists and cardiologists now believe this is a personalized decision based on age, genetics, comorbidities, and even APOE4 status. APOE status is all about your genes, specifically the APOE gene, which can affect your risk of developing Alzheimer's disease. Some versions of this gene raise the risk, while others don't. Is there a specific group of people who should be more cautious? Yes. Certain people might be more vulnerable to cognitive effects from statins. These include adults over the age of 75, people with low baseline cholesterol levels, those with a personal or family history of memory problems, and individuals who are sensitive to medications in general. The good news? In most cases, if memory issues do occur, they are reversible, usually improving within weeks of stopping or switching the statin. What if statins could actually prevent certain types of dementia? Let's not forget, dementia isn't just Alzheimer's. One common cause is vascular dementia, which results from reduced blood flow to the brain. This is often due to small strokes or atherosclerosis. And guess what? Statins do. They improve blood vessel function and reduce inflammation, two key factors in brain health. So, in patients with high cardiovascular risk, statins may offer dual protection for the heart and the brain. So, should you stay on your statin, stop it, or switch? Here's my pharmacist take. If you've been prescribed a statin and you're not experiencing any memory issues, don't panic. The benefits from your heart are clear, and the risks to your brain are likely very low for most people. But if you or a loved one start noticing brain fog, memory slips, or confusions shortly after starting a statin, talk to your doctor or pharmacist. They might recommend a dosage adjustment or switching to a more hydrophilic statin. Remember, personalized care is key. We're not one size fits all, and neither are our brains. If you found this video helpful, give it a thumbs up and share it with someone who might be wondering the same thing. And if you want more straight talk about medications, supplements, and how to stay sharp as you age, subscribe and hit that notification bell so you don't miss the next one. Be sure to watch my video on Rexulti, the first FDA-approved drug for dementia-related agitation. Just click the thumbnail above. Until next time, be happy, be healthy, and I'll see you in the next video.